Folks, so I want to take a bit of time this week to talk about the current election we have coming up. There are a lot of distractions trying to take our attention away from it and what it should mean for our country. And the things that our either current leader or incoming leader should probably start focusing on to really benefit us as Americans. Um, I, for one, don't care about Iraq or Kuwait or, for that matter, the Ukraine. I don't care about them. They aren't my country, they aren't my problem. I'd like to see our leaders start focusing on us and addressing some of the issues that we have as a nation. So I'm going to talk about a few of the things over the next couple of weeks that I think are big issues for us as Americans. I think the first one I would fall to would be healthcare. Now, I think we all saw with Obamacare, we're never going to be, in our current state, a socialized medicine country. It just won't work. We as a people are too me-oriented. And the idea of paying for someone else's problem doesn't work for us. It's just not who we are. Now, I personally feel that we do need a healthcare system in this country. But I think the biggest obstacle to it is we as Americans want to know that we're getting representation without getting screwed. So here's how I think the situation could be fixed and a healthcare system could work. First, the healthcare system, for it to work, people have to feel it'd be worth their money. So it should cover being sick. No one wants to die of a cold. No one wants to lose their job because of a cold because they can't get basic treatment. Yeah, for the most part, colds and flu, there's not a lot you can do. But there are other circumstances that having a doctor could help. So it should cover you being sick. It should cover if you get hurt and can't work. Fixing you. Not long-term care, fixing you. Identifying the problem and fixing you. Not making you a money sponge for big pharma, but fixing you so you can go back to work. And it should cover life-threatening illnesses. Cancer, AIDS, junk like that. We live in the greatest country on earth. Nobody should die without a fighting chance. Period. Okay? But here's where we run into a problem. Okay? Because there are selfish people who believe that other things should be covered by a national health care program. For lack of a more polite term, I'm going to say alphabet people feel like their lifestyle choices are our problem. No national health care program should cover transition surgery or any other surgery associated with alphabet issues. I'm not saying these people shouldn't have the right to live happy, but their personal choices should not be our problems. So what should happen is those issues that I talked about, okay, the things that can keep you out of work, the things that can keep you from being able to take care of your family, those should be covered by a national plan. Strictly regulated to fix you. Get you in, get you out, get you back to work. Within reason, of course. Nobody's saying, duct tape it and send them back down. No. We fix the problem. 100% fix it. If you have a hernia, we fix it. If you have a busted back, we fix it. This is the year 2020. There's nothing in the world that we can't fix right now. Most problems out there, there is a medical answer. Now, there's other problems, alphabet problems. They aren't something that should be covered by that because they don't keep you out of work. Just because you want to be mutilated doesn't mean you can't work. At the end of the day, we are a capitalist nation, and our nation thrives when people work. Simple as that. Yes, there are people who can't work out there. There are disabled folks, and I'm good with that. That's a whole nother system for us to deal with this, okay? Now, some other things that shouldn't be covered, and one of these is going to be with a caveat. A couple of these are going to be with a caveat. I think our drug problem in this country is largely a medical issue, and should be covered once. Once. You should be put through the system, rehabilitated, get you cleaned up, get you back on your feet, and get you working again. Once. After that, you have to go to private insurance. Same with alphabet issues. Private insurance can handle those. If you want to pay your private insurance to get those services, more power to you. But it's not the taxpayer's problem. One time with drug addicts. One time. Give them a chance to get cleaned up, back in the workforce. If they can't hack it after that, goes to private insurance. Cosmetic surgery. The caveat I would put to cosmetic surgery is for women who have suffered breast cancer, breast augmentation surgery to give back what they lost. I have a family who suffered through breast cancer. It is a horrible, debilitating, and demoralizing disease for a woman, and in some cases men. Every woman should have the chance to reclaim their femininity and feel good about themselves again after cancer. That's just my opinion, though. Anyway, we look at these issues, and like I said, a lot of those things should go to private insurance. The things that don't keep you out of work, the feel-good stuff, should go to private insurance. Pure and simple. I think that's something we as Americans might get behind. Now, the other thing about this is everybody gets this across the board. This insurance, whether you're Joe Plumber or Bill the Congressman, everybody gets this insurance across the board. If you want something else, you pay for it out of your pocket. There's no subsidies from the government for it. There's none of that. If you got a reasonable way to apply a tax to cover the cost of those basic services, you cut all the bullshit out, all the alphabet stuff and all the stuff that the system covers now, and you fix a lot of the problems. Now, the other cosmetic thing that I think should be covered would be dental stuff. Dental injuries are painful, they're debilitating, they cause long-term health issues over the years. I went for years. I got one busted tooth, and it cascaded from there. And it caused me a lifetime of healthcare issues because I didn't take care of it. So that is another cosmetic thing I think should be covered. Beyond that, though, there's not much else that will keep you out of work. And yeah, dental issues will keep you out of work because, frankly, we as a society are very judgmental of appearance. very judgmental of appearance. Um, it's hard to get a job if somebody doesn't like the way you look. But anyway, this is just my 2 bits on healthcare. If you have anything you'd like to add to it, feel free to hit us up in the comment section or join the conversation on MeWe and Facebook. As always, folks, be decent to each other. We're all in this together. God bless.